I want you to ask questions. We are talking more about menopause, and it appears to be a wave, whether it's from social media, books, morning programs, TV, and even articles. We are discussing menopause and symptoms. However, we're also discovering that some symptoms related to menopause were not previously thought to be so. That depression and irritability is not just in your head. As we talk about symptoms, we're also talking about treatment. Hormone therapy was once shunned as a universal treatment for most women suffering from menopause and symptoms. However, it is now becoming increasingly prescribed. The science shows it is largely beneficial for women who are suffering from menopause, especially severe symptoms. But are the effects of hormone therapy well understood? Do people understand what menopausal hormone therapy does to the organs of the body? I'm Dr. Nazneen Jamal, and in this menopausal series, I'm going to break down the impact of estrogen and progesterone on the other organs of the body. We're going to discuss cardiovascular disease. And in a previous video, I've discussed how cardiovascular disease is a #1 killer of women in terms of health-related illnesses. But do we understand how the estrogen and progesterone affect the heart? Can it make it worse? What's the difference if estrogen is used alone versus in combination? We'll explore stroke risk. We'll even explore venous thromboembolism or blood clot risk. We'll even talk about the impact of hormone replacement on cholesterol. I'll discuss the impact on blood pressure. The video's already been released. Body weight, fat, and even more importantly, one of my favorite topics, we'll discuss the role of estrogen on cognitive function and the risk of dementia. We're going to discuss data from the Women's Health Initiative, which is a newer study, and we'll also discuss other newer trials. Not everyone is going to be a candidate for menopausal hormone therapy. It's not safe for everybody, but ultimately I'll provide the nuance to make it make sense to you. I'll set up the context and emphasize that your unique situation is known to you and your doctor and ultimately is discussed in a shared decision-making process. I want you to know not what hormone therapy does, but why the effects differ based on age, timing, dose, and the type of estrogen. My goal is simple. When you walk into the doctor's office, you will be confident, informed, and empowered to advocate for yourself. I want you to ask questions. So let's begin.